Hello. In this video, we're going to talk about the anatomy of the femur, the longest and the strongest bone in the body. So let's get into it. Anatomically, the femur is a long bone, and it consists of three main parts: the body, the shaft, also called the diaphysis, the two ends, which are called the epiphyses, and the border between the diaphysis and the epiphysis, which are called the metaphysis, which are approximately here. Proximally, we have the head of the femur, the neck, and all these structures that are insertion points for some muscles of the lower limb. For example, the greater trochanter, lesser trochanter, gluteal tuberosity, and such. Some of these muscles that we can mention quickly are the iliopsoas muscle, which inserts on the lesser trochanter, the gluteus minimus, the gluteus medius, and the piriformis muscle, which all insert on the greater trochanter. The intertrochanteric crest for the quadratus femoris, and the linea aspera being an insertion point for a lot of the leg adductor muscles. The head of the femur forms a joint with the pelvis through a structure called the acetabulum, which we can see here. We can also see a little hole on the head of the femur, which is called the fovea, which contains a ligament and an artery supplying the head of the femur. This is a functionally important area because if there is a fracture in the proximal part, the blood supply of the head of the femur will be at risk. On the distal aspect of the bone, we can see two condyles, the medial and the lateral condyles. These form articulation with the tibia, which is part of they create the knee joint together, and they're all covered by cartilage. You can also have the epicondyles here, lateral epicondyle, and the medial epicondyle. And here we can see a tiny notch, which is called the adductor tuberosity. In these slides, you can see some structures from different perspectives. You can pause here to study these. Here we can see some insertion points and some origins of the muscles of the lower limb. This would be it for this presentation. Here, for my conclusion, I'm going to give you some just fun clinical facts. When someone says they broke their hip, that means actually they broke their femur, not the hip bone itself. And it's very common in, for example, the head of the femur. In this picture we can see it's stuck in the acetabulum, and also the neck. Here we can see a fractured neck of the femur. And this is common in elderly women due to osteoporosis, because elderly women tend to get osteoporosis with age. Osteoporosis being the condition that causes the loss of bone density. The bones are less dense, and that's why they will break easier. And that's why it's prevalent in women when they get older. Thanks for watching.